Hello everyone, welcome to Community Medicine Insight. In this video, we will learn about Labor Room Quality Improvement Initiative, that is LaQshya. Before going into details of LaQshya initiative, we will understand why this program was being launched. Despite increase in the institutional delivery after the launch of National Health Mission, maternal and newborn mortality did not reduce proportionately. And one of the major challenges was the poor quality of intrapartum and immediate postnatal care which was provided in the health facility. And half of the maternal death each year can be prevented if we provide high quality of health care. Data shows that 46% of maternal deaths, more than 40% of stillbirth, and 40% of newborn death they occur on the day of delivery. So the quality of care is a critical aspect with respect to the care around the labor and delivery and during the immediate postnatal period. To tackle this problem, the Government of India has launched LaQshya initiative in the year 2017, and the program was launched to improve the quality of care in the labor room, in the maternity operation theatre and obstetric ICUs and HDUs. Target beneficiary in this LaQshya initiative include every pregnant woman and newborn delivering in the public health institution, and the goal is to reduce the preventable maternal and newborn mortality, morbidity and stillbirth which are associated with the care around delivery in the labor rooms and OT, and to provide a respectful maternity care. There are three objectives of this program. First is to reduce the maternal and newborn morbidity and mortality. The important causes are antepartum hemorrhage, postpartum hemorrhage, retained placenta, preterm, preeclampsia, eclampsia, obstructed labor, puerperal sepsis, newborn asphyxia, and the sepsis. Second is to improve the quality of care, which was important during the delivery and the immediate postpartum care, stabilization of complication, and to ensure timely referrals. Third is to enhance the satisfaction of the beneficiaries. They should have a positive birthing experience and to provide a respectful maternity care. So here keywords are maternal and newborn morbidity, mortality, quality of care, satisfaction of beneficiaries, and respectful maternity care. What is the meaning of respectful maternity care? That includes there should be no physical, verbal or emotional abuse. There should be no neglect or rough handling or shouting at women during labor. To provide full information about the procedures, intervention, and to obtain informed consent before any examination or the intervention. Use kind and supportive language. Avoid unnecessary delay in the treatment or referral. Allow women to make decisions about their care, and to support the birthing position of choice and the presence of a birth companion. Following facilities are being taken under LaQshya initiative on the priority basis, that include all the government medical college hospitals, all district hospital and equivalent health facilities, all designated first referral unit, high caseload CSCs with over 100 delivery or 60 per month in hilly and desert areas. Coming to the strategies of this program, there should be reorganization on aligning labor room maternity OT's layout as per the standard guidelines which are issued by the Ministry of Health and Family Welfare. Second is all the government medical colleges, hospital, district hospital, they should have a dedicated obstetric HDUs and obstetric ICUs as per the government guideline for the management of complicated pregnancies. Third is to ensure the strict adherence to the clinical protocols for the management and stabilization of complication before referral to the higher centers. Coming to the key features of this program. In this program, what the government is doing, it is improving the infrastructure. Second, ensuring the availability of essential equipment. Third is providing an adequate human resources. And then capacity building of the healthcare workers and improving the quality of care processes in the labor room. Once we have human resources, then we need to train the healthcare workers. That is the capacity building of healthcare workers. Fourth is the implementation of fast-track interventions. Capacity building of healthcare workers by skill-based training like Dakshata and improving the quality processes in the labor room. And to strengthen the critical care in obstetric, a dedicated obstetric ICUs at medical college hospital level and obstetric HDUs at district hospital level are operationalized under the LaQshya program. Then we have a digital innovations also, that is LaQshya web portal. In this, all the LaQshya related data will be uploaded on the portal for the prompt report generation. There is an app called Safe Delivery app. It is a free of cost smartphone application that provides training to the midwives and other healthcare professionals with instant access to the life-saving and evidence-based guideline. This app is downloaded. It works at offline also, so it will be helpful in the remote areas as well. Coming to the sixth focus area of the program, first is the documentation. It aims at improving the record keeping and reporting of maternal and newborn care. Second is the respectful maternity care, RMC, ensuring every woman is treated with dignity, privacy and compassion. Third is the timely management of pregnancy complication. We have to make sure that all the complications are recognized timely and treated quickly. Fourth is the judicious use of oxytocin, that is using oxytocin safely and only when it is needed to prevent the misuse or complications. Fifth is the essential and emergency newborn care, ensuring every newborn gets proper care immediately after the birth and emergencies are handled effectively. And sixth is the infection prevention and biomedical waste management, that is maintaining cleanliness, preventing infection and proper disposal of medical waste. So LaQshya uses a step-by-step improvement process, focusing on one area at a time, improving it, maintaining it, and then moving it to next area. So with continuous support, training and monitoring from the expert to ensure a safe, respectful, high quality maternal and newborn care. How improvement is done? It is done using the PDCA cycle for each focus area. What is PDCA approach? P is for plan, that is identify the problem, make a plan for improvement. Do is implement the plan on a small scale. C is check, observe result and measure improvement. And A for act, that is standardize what works and apply it everywhere. In LaQshya, the quality improvement in the labor room and maternity OT will be assessed using NQAS, that is a National Quality Assurance Standard. And every facility is being judged on this. And when a facility achieves more than 70% score on the National Quality Assurance Standard, that health facility is certified as LaQshya certified facility. Once the health facility scores more than 70%, They are being categorized into different badges, and the facilities who score more than 90, 80 and 70, they will be given platinum, gold and silver badges accordingly. And those facilities who are achieving the NAQS certification, defined quality indicators and 80% satisfied beneficiaries, they will be provided incentives of 6, 3 and 2 lakhs for the medical colleges, district hospital and FRUs respectively. This slide depicts the summary of LaQshya initiative. It is a labor room quality improvement initiative. So quality here is the key term. It was launched in the year 2017. The goal is to ensure safe, respectful and the high quality care to the women and newborn during labor, delivery. There are three key objectives. First is to reduce the preventable maternal and newborn morbidity and mortality. Second is to improve the quality of care, especially during intrapartum and postpartum period. And third is to promote the respectful maternity care. The 6 focus areas include the documentation, respectful maternity care, timely management of complication, judicious use of oxytocin, essential and emergency newborn care, and infection prevention and waste management. The PDCA cycle approach is used for the quality improvement and mentoring.